We are here with Professor Juan Carlos Kaski, Director of Research at the St. George's University. Your speech here at this event was the management of angina pectoris. What are the causes of this disease and how do we treat it?
Yeah. The most common cause of angina pectoris is the presence of a narrowing in the coronary tree, which reduces the blood flow and causes this chest pain, which is what we call angina, and is a reflection of a lack of oxygen in the cardiac cell. So that's essentially the mechanism and probably the most accepted paradigm at the moment. So we speculate, cardiologists actually base their treatment of this condition in the understanding that there is an imbalance between blood supply by the coronary tree and an increase in the demand of the heart. When that imbalance becomes serious, then the chest pain appears and there is sort of all the manifestations of reduction in blood flow. Today I actually raised the issue that the paradigm of just coronary artery disease as the only cause for angina should be changed. I believe that there are many other dynamic mechanisms that can cause chest pain beyond the narrowing of an artery, and we are working on this. How we treat this condition, we essentially try to restore the blood flow to the myocardium, to the heart muscle. And we can do this in different ways. Medical treatment is really quite good, very, very good. We do not need to automatically resort to an intervention like stenting or a bypass operation to restore blood flow. Medicines do work, and very importantly, lifestyle changes work extremely well. So we have a good armamentarium. Lifestyle changes, management of risk factors, say no smoking, reduce cholesterol, reduce obesity, extremely important measures. Then we have drugs which reduce the heart rate and therefore allow more time for the blood flow to get to the cells. We have medications which increase the blood flow to the heart, like the nitrates, for example, or other vasodilators, calcium channel blockers. And more recently, we have identified other mechanisms that can cause a reduction in blood flow. And I mean, it's a rather complex mechanism, but essentially it's a reduction, this reduction in blood flow caused by stiffness of the heart muscle, which doesn't allow the small arteries to deliver blood. Now we have drugs which actually act on that kind of mechanism. So we have expanded the armamentarium. But my message to the cardiologist today was that to optimally treat angina, you need to combine all of these things. You need to understand the mechanisms and use the drugs, use the interventions on lifestyle, and use the intervention as appropriate. We cannot actually grab an off-the-shelf sort of recipe and say, well, this is what you need to use to give a treatment for angina to your patients.
What kind of patients are the ones that normally experience angina?
There are different kinds of patients with angina. Again, the most common mechanism and the most common type of patient is one with high sort of level of risk factors, say a smoker, obese, with high cholesterol levels, hypertensive, somebody with a pretty bad family history for coronary artery disease. Those people tend to develop atherosclerosis, and the atherosclerosis, if it progresses, occludes the coronary tree and causes ischemia. So we always look for the high-risk patients, and these are those with a large number of risk factors. In those patients, when we do an angiogram, it is common that we find stenosis which is rather severe and reduces the blood flow. So that's probably the most common type of patient, but not the only one. We do have individuals in whom the risk factors did not cause an obstruction to the coronary tree, but they still have ischemia, and the ischemia is caused by spasm of the large arteries or spasm of the micro vessels. And the spasm is a combination of an abnormality in the heart in the vascular muscle, but also it is a dysfunction of the natural mechanisms that open up the artery, so a lack of the intrinsic vasodilating activity. So those patients can have angina despite the absence of obstructive coronary artery disease, and they require very specific treatment. And there are other varieties, less common forms of angina, which are derived from, say, microthrombosis of the microvessels, etc. But those are less common causes.
Okay, and one last question. The mortality rate of patients with angina, and I mean it's a serious disease that can have serious consequences. So
chronic stable angina, if it remains chronic, carries a higher risk of mortality, but it's not an excessive risk. The acute coronary syndrome is a very serious condition which actually carries a very high mortality, and it's an acute process. The chronic stable angina is a more gradual process, so 3 out of 20 each time you actually do statistics, more or less that's the figure. 3 out of 20 patients with stable angina will have some kind of episode, not necessarily mortality, some acute episode or exacerbation or requiring hospitalization or death. So it is not a benign condition, but it's not as serious a condition as the acute coronary syndrome. However, people with chronic stable angina could actually develop unstable syndromes if they're not treated properly. And the treatment is the one I just discussed before.